Alrighty, so if you're watching this, you're here to see us for a facelift pre-op. Facelift pre-op, is a couple of things we ask you to do that we don't ask everybody in their pre-ops. The main one is come in without wearing a significant amount of makeup. So us being able to see your face in its native form and in all your natural beauty is super important. We want to be able to see every line on you so we can try and address those lines. Those pictures that we take of you during a facelift consultation, and Stacy, our physician's assistant, will be the one seeing you for that facelift, not consultation, pre-op. She's going to be taking photos of your face, and she's going to take some with a flash, some without a flash. That's so we can capture the different lighting in your face and being able to see the different aspects of your face and highlights of your face, so we can make sure that we address those perfectly. And sometimes people's makeup will cover up things like small fatty tissue pockets under their eyelid, or a flash bulb with our camera might cover up those things. And so we want to be able to see those things perfectly, because when you're laying down on an operating room table, your face lays in a different position than it does when you're standing. And so we've got to be able to see things, what it looks like when you're standing, so we can see them in the operating room and sometimes refer to them to get the exact outcome we need to get. So that's what's going to happen at your facelift pre-op. Stacy's going to take photos of you. She's going to give you prescriptions, and there's typically 3 main prescriptions you're going to get. A narcotic, even though most patients don't take it. You're going to get an antibiotic that you just take for 3 days, and you're going to get an anti-nausea medicine. And I think with facelifts, that's a pretty important one. Every now and then, the sedation we give you, which facelifts are normally done under sedation, or what we call twilight, rather than general anesthesia. And the truth is, you have your choice. You can do it either way. But sometimes sedation for a few hours can make us feel a little bit hungover and not really well, and so that nausea medicine can really help us. So she's going to give you those prescriptions. It's important you get those ahead of time. And she's also going to go over your consent forms with you and your packet with you and answer your questions. And there's some things she's going to tell you a little bit about that are important for you to do.
Let me just add one other thing. There is another medication that we prescribe. It's for swelling, and it's called Medrol Dose Pack, and it's a pack, and you'll have the directions on how to take it on the back side of the pack. And we give that post-operatively. We have you start that a day after surgery to help with the swelling that's gonna happen in the upcoming week after your surgery. So that's an additional medication. He just didn't mention that. Back to the consent forms. Yes, the consent forms will be sent to you via email by our patient coordinator. It's super important that you read through that thoroughly before you actually come in for your pre-op appointment, because you will be signing consents. Obviously, we'll be answering a bunch of questions about those consents, and they have specifics as to what you'll be doing after surgery. So just make sure you read through those, and so you're able to sign them when you come in to see us. We also, as you mentioned, not having makeup applied before you come in. And one last thing about if you've been asked to get pre-labs before your procedure, an EKG, which is a common thing that we ask to have done before your procedure, make sure you have those done and completed before you come in for your pre-op. It's imperative we have those before your surgery, and sometimes that can delay your surgery if we're waiting until the last minute to get those. So medications, again, back to the medications, super important you pick them up right away after I prescribe them, because sometimes then they end up getting put back on the shelf, and then you're calling us the day before surgery or the day of surgery, and it just becomes a little bit chaotic for you. So I think those are the big things to mention.
I think that pretty well wraps it up. That's your facelift pre-op. There you go.